Assalamu alaikum. I am Dr. Sharmin Khan, Assistant Professor, Department of Physiology, Mainamoti Medical College, Kumilla. Welcome to all my dear students in this session. As all of you know that we are passing very hard time due to pandemic attack of COVID-19, which drastically changed the whole world. May Almighty Allah protect us all. I hope all of my beloved students are doing fine, Alhamdulillah, and continue your study seriously at home because you know that first professional MBBS examination is just knocking at your door. So stay home and you have no choice but have to study hard now. Now, today I am here to give you some SQ suggestions from paper 2. Now, let us start from the renal system. My first question is, what is nephron? Classify nephron. What are the functions of nephron? Draw and label the different parts of a nephron. Write the different parts of renal tubules with their functions. Enumerate the functions of kidney and write the endocrine functions of kidney. Now the next question is briefly discuss the peculiarities of renal circulation. Discuss the role of kidney in maintaining water balance in our body. Discuss the role of kidney in regulation of blood pressure. Again, discuss the role of kidney in long-term regulation of blood pressure. Now define autoregulation. How autoregulation is maintained in renal bed. Define GFR and name the factors influencing it. How GFR can be measured. Define and calculate net filtration pressure. Mention the forces which favors filtration and forces which opposes filtration. The next question is, what are the difference between glomerular filtrate and urine? Now, draw and label the glomerular membrane and discuss the mechanism of filtration in this bed. Why can albumin not filter through the glomerular membrane? Differentiate between glomerular capillary and peritubular capillary. Why glomerular capillary is more permeable than other capillaries? The next question is, what are the substances that are reabsorbed and secreted in the kidney tubules? Name the substances that are secreted from proximal convoluted tubule and distal convoluted tubule. Mention the mechanism of action of acidification of urine. What do you mean by renal plasma clearance value? Explain the mechanism of water conservation by the kidney in dehydration. Describe the mechanism of renal tubular reabsorption of sodium and glucose. Discuss the mechanism of reabsorption of water at different parts of renal tubules. Now, what are the hormones that act on kidney and what are the effects of them? Now define tubular transport maximum, renal threshold, plasma load, tubular load, renal fraction, filtration coefficient, obligatory urine volume, facultative urine volume, anuria, oliguria, polyuria, glycosuria, proteinuria, diuresis, free water clearance. The next question is, name and discuss the basic process of urine formation. Differentiate between water diuresis and osmotic diuresis. List the renal function tests. Mention the clinical importance of physical test of urine. Now give the composition of normal urine. Show with a diagram the role of kidney in acid-base balance. What is countercurrent hypothesis? How concentrated urine is formed? What do you mean by juxtaglomerular apparatus? Briefly discuss the mechanism of dilute urine formation. Now, briefly discuss about micturition reflex. What is atonic, automatic, and neurogenic bladder or neurogenic uninhibited bladder? Same thing. Name the substances secreted from renal tubules and mention the importance of this in relation to acid-base balance of the body. Define plasma clearance of a substance. If the plasma osmolarity is 300 milliosmol per liter, urine osmolarity is 600 milliosmol per liter, urine flow is 2 ml per minute, then calculate the osmolar clearance and free water clearance and comment on it. What do you mean by renal threshold? Explain that renal threshold for glucose is 180 milligram per deciliter, whereas TMG, that is transport maximum for glucose, is 320 milligram per minute. What do you mean by plasma load and renal tubular load. Calculate the tubular load of glucose if the plasma glucose is 120 mg per deciliter, GFR is 120 mg per deciliter, and renal plasma flow is 650 ml per minute. Now name the hormones that regulate tubular reabsorption. If the plasma flow through both kidney is 650 ml per minute, GFR is 125 ml per minute, what will be the filtration fraction? Now, what do you mean by free water clearance and osmolar clearance? Calculate the free water clearance if urine flow is 0.5 ml per minute and osmolar clearance is 1.5 ml per minute, whereas the urinary volume is 800 ml per 24 hours, urinary concentration of creatinine is 12.5 mg per deciliter, and plasma concentration of creatinine is 3.4 mg per deciliter. Now the next question is name the body fluid compartments with their normal values. What are the difference between ECF and ICF? Now let us proceed to the endocrine physiology. My first question is define and classify hormone. Name the endocrine glands of human body. Write down the general mechanism of action of hormone. Describe any one of them. Next question is name the hypothalamic hormones. Discuss the role of hypothalamus in regulation of pituitary secretions. Here you have to mention both anterior pituitary and posterior pituitary secretions. Name the hormones from the posterior pituitary gland. How its secretion is regulated by hypothalamus. Now the next question is write down the functions of posterior pituitary hormones. What is the role of ADH, that is antidiuretic hormone, in regulation of body fluid osmolarity? Describe the functions of growth hormone. Name the factors stimulate or inhibit the secretion of growth hormone. What is gigantism? What do we mean by dipeptogenic and ketogenic effect of growth hormone? Write down the features of acromegaly. What is somatomedin? Elaborately discuss the role of this factor on somatic growth. Now, what are the difference between diabetes mellitus and diabetes insipidus? Enumerate the functions of calcium in our body. Now, show in a diagram the hormonal control of blood calcium. What is calcium rigor? List the important functions of thyroid hormone. What is Graves' disease? My next question is name the hormones secreted from the thyroid gland. Write down the steps of synthesis and secretion of thyroid hormones, that is biosynthesis of thyroid hormone. List the features of hyperthyroidism. Briefly discuss about myxedema. Write down the effects of thyroid hormones on 5 target tissues. What is myxedema madness? How thyroid hormone secretion is regulated. List its role on CVS and CNS, that is cardiovascular system and central nervous system. Now, what are the difference between myxedema and cretinism? State the functions of thyroxine. List the thyroid function tests. What are the difference between a pituitary dwarf and a cretin baby? Write down the functions of parathyroid hormone. Now, name the steroid hormones. What are the role of cortisol in stress and inflammation? Now, write the adrenocortical hormones. Write down the mechanism of action of these hormones. Adrenocortical hormone means only the hormones which secreted from the adrenal cortex. Now, the next question is name the hormones secreted from adrenal gland, which means from both cortex and medulla, and summarize the functions of cortisol. Briefly discuss the metabolic and non-metabolic effects of cortisol. Why cortisol is termed as stress hormone. Now write down the functions of aldosterone. How its secretion is regulated. Why aldosterone is termed as life-saving hormone. Acha. Now I repeat, write down the functions of aldosterone, how its secretion is regulated, why aldosterone is termed as life-saving hormone. Now names the hormones secreted from islets of Langerhans. Give the mechanism of action of insulin. List the hormones that increase the blood glucose level. How insulin decrease blood glucose level. Now, enumerate the effects of insulin lack in our body. Give the function of glucagon. How blood sugar level is maintained in our body. Now, write short notes on insulin, aldosterone, Addison's disease, calcitonin, thyrotoxicosis, dwarfism, parathormone, acromegaly, Cohn's disease, gigantism, diabetes mellitus, cretinism, Cushing syndrome, goiter, trophic hormones, milk ejection reflex, aldosterone space, aldosterone escape, and tetany. Hope you all guys are already solved this written question. So please don't waste your time. I want to mean a single moment of your life and make a routine and continue your study seriously and regularly at home to prepare yourself for passing the examination. May Almighty Allah help you all. Thank you for all the best.